Welcome. Come with me. The doctors will see you now.
Welcome back to Fast Talks with Family Docs. Today on this episode, we're joined again by Dr. Sam Ratermann. And in the last episode, we talked about how he's a blueprint for a family physician with his depth of knowledge and his diverse experiences, whether it be being a hospitalist at Integris Grove Hospital, being involved as medical director for hospice, and even doing child abuse victim examinations and helping the patients in Grove as they navigated that COVID pandemic. And we're back again to discuss more with them. Dr. Ratermann, thank you again for joining us.
Yeah, thank you, Sam.
Thank you, guys.
Awesome, sir. So moving forward, we've had a lot of doctors who are serving rural communities on the podcast, and each of them had their own unique challenges, per se, whether it comes to resource access, social determinants of health, patient education, you've mentioned that, and then community engagement. What are some of the biggest challenges you encountered at where you practice in Grove?
Yeah, I mean, you've pretty much named it. I think number one is resources, and it's not always, the number of providers that you have in a community. I actually have several in Delaware County. It's access to specialists, enough nurses to help put patients into hospital beds. It's having appropriate respiratory therapists and nurses in your nursing homes. I mean, there's really been a contraction of the amount of people available to provide medical care at all levels. And we're a team. We have to have all these people. So what I've really been working on is trying to get those resources back, whether it's trying to get students into our hospital to rotate, encouraging people to go into some of these fields, or even bringing in the telespecialists. Another one I've really seen, especially in my area, is just a lack of trust in medical science. That has been really hard. I was meeting with a patient the other day and trying to discuss, her BMI of over 50 was contributing to her high blood pressure. And I mean, she looked at me just straight in the eye. She says, I don't believe that I had blood pressure, and I don't have any weight problems, and I don't believe in taking medications. And so you want to say, wow, I really have an opportunity to help somebody here to change the trajectory of their health. And she was very polite, but also just very matter of fact. There's nothing that I could say that was going to change her mind.
Yeah.
And that's really hard. It was hard during COVID. I remember somebody wanting to physically attack me because we used an antiviral treatment that was standard of care, remdesivir. It's been a big challenge.
Wow. What do you think that springs from? Do you think there's some cultural things there? Do you think it's misinformation on the internet? Any ideas?
Oh, I have a lot of opinions, but I think right now we're just in a kind of a cultural revolution, where people want to justify what they know and make it true no matter what. Whereas as physicians and as scientists, we look at something and say, okay, I have a thought, but I need objective evidence to either prove or disprove what I'm thinking or my treatment plan. There's a lot of people who are choosing what they want to believe and not believe. And it's their right. They can do that, but it's just hard to provide medical care when you're in that environment.
It is. And I think I'm not going to chase us down this rabbit hole, but just as an aside, I've been talking to the residents at our program recently about measles.
I was about to ask that question.
That's beginning to make a comeback across our country.
Yeah.
And that's one of those areas where, as you said, people have their impression as to what's right and what's real and what the role of medicine, if any, is in their life. And they grew up in a world that didn't have to deal with measles and mumps and deaths from that and polio. And my fear is, as a physician, that we're going to start seeing a resumption of those illnesses in the community. And that's going to be a really difficult path to walk with our patients.
and I think for a lot of the providers, there's some moral injury to that, saying, okay, this is something that could have been prevented. This is something we know worked. We have the key to this. We have the answer to this, but being able to provide that information, and a lot of that starts with just trust in the community, and that starts in the clinics. It starts, by the time they're at the hospital, they've already formed an opinion. So
Right.
it starts when somebody's at their general wellness exam and developing trust with their provider, developing that respect, and then taking that information and digesting it and having the ability to come back for follow-up and have some honest education. I had a patient the other day didn't want to take a blood transfusion because he was afraid that a donor may have had a COVID vaccine and that was going to adversely affect him,
Mhm.
although his hemoglobin was obviously the biggest determinant of his health
Right. Yeah.
at that time is anemia. And so, again, I just tell him, hey, I respect your decision. Let me provide as much information that I can in a way that he could understand it and make a decision. So,
So, Sam, you've worn so many hats and you're juggling so many things and spinning plates and you've got a lot going on all the time. And roles you've had are both emotionally and physically demanding. And we know physician burnout is one of the major issues in our profession today. How do you manage stress? What do you personally do to try and prevent burnout? And what advice would you give? I think you're 15 years into practice. So, what advice would you give to young doctors who are beginning practice now to pay attention to in that regard to help their careers?
first thing I'm going to say is it's real. I hit that wall, 150 mile an hour, smashed into it, been there, recovering, burned out physician. I think when I was in residency, that was a big buzzword. Don't get burned out. Don't work too hard. Take time for yourself. But nobody really knew what it was. When you get into practice and you do start taking on these hats, and there's a lot of excitement to it. I
Oh,
want to help
definitely.
people. That's what I trained for.
Yeah.
In initially that pager goes off, man, somebody needs me. I'm important. I'm going to go take care of that. There's a lot of adrenaline to that, but that does burn out pretty quick. And if you're not taking care of yourself, there's some real effects of that, not just to you, but also to your patients and also to your family.
Yeah.
And if you don't know the warning signs to look for, you're going to hit it. And I think most of us that hit that wall don't know that we're hitting it. We need somebody a little bit more experienced to say, grab you by the shoulder and say, hey, you're going at this a little bit too much. Let's slow down. I found some great books. Stop Physician Burnout by a guy by the name of Dr. Dyke Drummond. Actually ended up getting to meet him at a conference, going to some conferences, trying to learn a little bit more about it. Eventually, finding my own counselor, personal counselor, somebody that I needed to talk to and kind of debrief and find some better ways for me to cope with a lot of that
Yeah.
stuff, and find better ways forward. And a lot of that, I had to say, okay, I can't be everything to everybody. I need to put up some better boundaries, something wasn't skilled at the time. And once I was able to set that and kind of find myself, then I could start feeling some of that gorilla lifting off my shoulders.
Yeah. Well,
And I think that can be hard, especially in a rural community when there are fewer, as you've already mentioned, fewer resources for your patients, and that kind of expectation. I need to do it for them, but we still have to take care of ourselves and find our limits and recognize those limits.
and where everybody knows you. Right.
Well, and I remember my wife saying to me, she was, upset one night, and not at me, but just another canceled date night, and she said, "Hey," she says, "I get it. You're a physician. You respond to emergencies." She said, "The problem is there's always an emergency."
Yeah.
It kind of dawned on me, as a physician, it's our job to know how to take care of emergencies, but it's our also our job to be emergency managers. I'm not doing a good job for my patients if they're waiting on me to manage an emergency. I need to set up a bigger system around me to help take care of that. That will ultimately help the patient. It also helps me and my family and my wife and my relationship with my kids and everything around me. And that is a big part too of trying to set limits to work, but also bring those people in that we had talked about in the last episode as far as telehealth. If we can bring that in to provide that expertise, so I'm not spending all night looking at 10 more articles figuring out how to take care of my patient. I
Yeah.
have an expert who can do it in 10 seconds.
What a great
Yeah.
perspective.
Yeah.
Yeah.
Wow. That's wise beyond. Yeah. That's great. So I want to thank you for talking about burnout and talking about, our mental health and its matter. I think we need to normalize this
Yes,
and not
for
be
sure.
afraid to talk about it. But, talking to people with experience like you and leaders in the field, and me being, 5 years into practice now and experiencing some of that burnout. One of the questions I've been wanting to ask our guests is, with all that you do and all the day-to-day stressors that you have and balancing family life and all the other hats you're wearing, what keeps pushing you every day to wear that hat of being a doctor again? What keeps inspiring you so we could take some lessons from that and try and incorporate that into our own life?
I think for everybody it's different. For me, I feel that what I do is a spiritual calling. I need to be here. I've been directed to be here. I've got care to provide. You need a fantastic support team. I have an amazing wife. I have an amazing family. I also have a hospital group of staff that I get to work with every day. They support me, I support them, and it's nice in a small hospital. We get to know each other very, very well because it's the same core group of staff that's there, every day, every other day. But then you also have to find some other intrinsic value. I try and look every day for one positive interaction. Hopefully, I can find more than that. The other day, I was taking care of somebody in the hospital, and she says, "Oh, I remember you. 12 years ago, you allowed me to come in on your lunch break and sew up my forearm that was bleeding. Hey, look at the scar." And, this nice scar form. Like, oh, I don't even remember that, but how many other interactions did I provide care for somebody that they remember? Probably not the best boundary example, but for this example, for me too, when I took over the hospitalist program, there was a journal who had ranked our specific hospital the highest mortality rate in the country for CMS reported hospitals. Our hospital was not that bad at the time. It was more of a coding issue. And so I said, okay, I want to address that. I want to fix that. I want to be the best coder that I can and make sure that all these insurance companies are seeing the complex patients that we're taking care of. And it took a long time, but since then, our small rural hospital, we've been recognized by CMS as a 5-star hospital twice. We've had really high quality and safety awards, and I don't take credit for those personally, but yeah, I'm part of the team in trying to set the expectation that we're going to do the best we can. And
congratulations
Yeah,
to you and your team on achieving that. Yeah,
that's amazing. Yeah,
really good deal. Well, Sam, we're going to call it quits here for today, but we are so appreciative of you taking the time to visit with us, to share about your life and your practice in Grove, and give our listeners and viewers another idea of what is possible in the realm of family medicine. So thank you so much for your time.
Yeah, appreciate it, sir.
Thanks a lot, guys. I really appreciate it. Thanks for what you're doing. These podcasts have been great.
Thank you, Sam. And thank you, viewers and listeners. We'll see you next time on Fast Talks with Family Docs.
Bye.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast and you will automatically be notified when it's time for your next appointment.